Welcome to the Capital Integrative Health Podcast, a podcast dedicated to transforming the consciousness around what it means to be healthy and understanding the root causes of both disease and wellness. I am Dr. Andrew Wong, co-founder of Capital Integrative Health, an integrative practice committed to expanding access to holistic root cause medicine to the global community. Today we are excited to be joined by Dr. Rosie Sheinberg. Dr. Sheinberg is an assistant professor of anesthesiology and critical care medicine at the Johns Hopkins University School of Medicine. Her areas of clinical expertise include anesthesiology, cardiothoracic anesthesiology, medical acupuncture, and integrative medicine. Dr. Sheinberg serves as the Director of Integrative Medicine for the Department of Anesthesia and Critical Care Medicine at Johns Hopkins and has been board certified in integrative medicine since 2014. Join us for a conversation today about optimizing perioperative care, the care before, during, and after surgery. Surgery doesn't have to be scary. There are things you can do to improve your recovery times, improve clinical outcomes, and overall improve your experience with surgery. If you or someone you love is undergoing surgery in the future, this episode is for you. Welcome, Dr. Sheinberg, to the podcast. So great for you to be here today.
Dr. Wong, thank you so much. Pleasure is mine. It's great to see you again.
Yes, you too, Rosie. And I think we met just for the listeners, and part from our time at the University of Arizona Integrative Medicine Fellowship, where we just had a great time there. You know, it's mostly a distance learning fellowship, but there were 3 weeks of residential fellowship. So we can talk about that in a minute, but first of all, just for all the listeners here, Dr. Sheinberg, what motivated you to pursue medicine?
Ooh, good question. So I think, interestingly, so I was very heavily into gymnastics and dance growing up. I was, sort of at that pre-Olympic level and also, very high level in ballet. And in those pursuits, you really develop a natural interest in the body. It's the tool of your trade, high potential for injury and overuse injury. So there's a lot of contact with the medical community. So I think I always wanted to be involved in sort of health and wellness in some capacity, just because of my experience, in dance and gymnastics growing up.
And the medical system and the doctors and the practitioners you went to probably helped you out a lot so that you were able to continue with dance and gymnastics. Is that right?
That's right, Andy. It did. Growing up in these areas, like I went to a doctor if I needed to go to a doctor. And then I also did other things to stay really at the top of my performance and, staying healthy and well. Nutrition was really important in being able to perform at the top. Sleep was important. We learned early on sort of stress reduction things to help us get through competitions and performances and the nerves through that. So it always made sense to me that that you kind of dipped into both worlds of the health and wellness arena, the kind of standard medical treatment, as well as sort of more complete wellness world, to achieve whatever goals you had, to kind of be at peak operating capacity.
Yeah, and I think this is gonna connect to later with perioperative medicine here, but I have a question from, with you growing up and doing dance and gymnastics, is that did your coaches ever, or maybe you found this yourself, doing some sort of visualization before performances and, practices even?
Yeah, I had an amazing gymnastics coach growing up. And in the 80s, the Russians were the best in the world at gymnastics.
Yeah.
And so he learned Russian, so he could translate their Russian training manuals and utilize some of their, training techniques that they were utilizing to create world-class athletes in gymnastics at the time. Yeah. And part of that was they did what they called at the time mental rehearsal. So they did use kind of visualization techniques and, using kind of visualizing your performance and different components. And so I learned that early on, where I think it wasn't commonplace in athletic training like it is now.
Right. And I think we all know this, there's the functional MRI studies from Harvard that show that there's, if you imagine playing the piano versus playing the piano, it lights up the same area of the brain. So you can use that in probably guided imagery visualization for performance, but also for, before a surgery. And we know that you're an anesthesiologist at Johns Hopkins. So kind of just wanted to get more into that. How'd you get into anesthesia? And then how'd you get into more integrative medicine as well?
Yeah, good question. So going through med school, I tried to keep an open mind. I sort of enjoyed everything that I did, all the different medicine subspecialties and, along the
Yeah.
way. And when I got to anesthesia, what I particularly liked was this combination of things. One was that it's so I was a biochemistry undergrad. So I love sort of the underlying thinking about like the mechanisms of how things work. And anesthesia puts that into practice in real time. So if I'm, giving a drug, for example, it's going to go through a certain pathway and have a physiologic effect. And I get to see that in real time. I've always called anesthesia medicine for the impatient. And yes, I am a self-admitted impatient person. I'm not good at waiting for things. So I think in medicine, you tend to have to wait for results where you prescribe a medicine and someone has to go out and fill the prescription and then actually take the medication and then come back in a few weeks and report how things are going. Well, anesthesia sort of does all of that physiology in a compressed time frame. So I enjoyed that aspect of it, the direct pharmacology aspect. I liked that it is, there's a lot, so it's a real good combination of thinking, kind of the medicine, the machinations, and the thinking about pathways and how to keep people safe and, how to get through a surgery with the physiologic changes, but also doing. So we have a lot of hands-on procedure type things where I can put bypass cannulas in the neck and, a lot of big IV access. I'm doing nerve blocks and epidurals, as well as different airway management techniques. So also procedure based. So that part I enjoy as well. One of the big roles that I enjoy in anesthesia is that a surgeon is kind of the hero of any patient's, when they have a surgical experience. They're the one they remember their name and they look to really fix a problem that they have. And I feel like the anesthesiologist role is kind of the unsung hero role. I think there's a lot that people don't know about that happens while they're asleep under anesthesia. And there's a lot of, stress and physiologic manipulation on the body that happens. And so I think our role is that really the protector role. I mean, if I take away someone's ability to do all the life-sustaining things that one normally does for oneself, breathing, blood pressure regulation, temperature management.
Yeah.
If I were having surgery, I would certainly want someone I trusted to take over that role and be very diligent about protecting me while I couldn't protect myself. And so I love being in that role.
Certainly surgeons do the surgery, but anesthesiologists make that surgery possible and smooth, almost like a conductor, but then you're playing the violins, making everything smooth. That's how I kind of see
That's right. It is a pure codependent, team-based relationship. Absolutely. One can't exist
yes.
without the other.
So it sounds like you love, connecting also the right and left brains, together with the procedure base, the analytical side, the instant gratification is amazing with the instant results you see from, administering a medication and seeing that person, I think stabilize, et cetera, heart rate, blood pressure, et cetera. So that's great. And then how did you find out about and get into integrative medicine, and why did you decide to go through the Dr. Weil fellowship that we both went through?
Yeah. So I think it actually is almost a reverse thinking process. That's always the question. Well, how did you get into integrative medicine? But I think that's what led me into medicine in the first place.
Yeah.
Going back to my days in dance and gymnastics, I knew I wanted to be in this health and wellness world. And so, in fact, before I was thinking about medical school, I was actually thinking about a pathway to become a naturopathic physician.
Yeah.
And which is a different training pathway. You still get, sort of your doctor designation, but your tool set really becomes non-pharmacologic, non-surgical agents. So you really, your bread and butter is really thinking about how do lifestyle components, how do different botanicals and herbs and supplements help someone become well, stay well, deal with different pathologies. And then, my thinking process was a certain subset of people in our country or in this world will go to a naturopath. I thought maybe I could bring those ideas of underlying health and wellness to a broader population of people if I had the quote unquote credentials of a Western medical degree behind me.
Mm-hmm. Mm-hmm.
So ultimately, that's actually what led me to go to medical school.
Yeah, yeah. I think I have a similar pathway too, just thinking about health and wellness from a very early age as well, and just knowing that's why I wanted to go to, into the healthcare field, to be of service, for people and in a way that, broadens access. But certainly, I know that, and I'm curious actually if you've, at Hopkins, have you also interfaced with lots of different other practitioners, naturopathic doctors, acupuncturists, specialists in the medical field? Because you've worked with a lot of different specialists yourself, correct?
That's right. At Hopkins, in general, it's a pretty conservative and historical institution. So within the Hopkins walls, I wouldn't say I've interacted with a lot of different type of practitioners, in the kind of complementary
It's one of the
world of naturopath.
first medical schools, right? So yeah,
Yes,
yeah, yeah,
exactly. So it has a very rich and long tradition,
right.
but very steeped in the Western medical world. So
Mm-hmm.
I come into contact. What keeps me excited about being at Hopkins is there are amazing people who
Yeah,
really, their strongest desire is to do good in the world and help people and help patients. And they
absolutely.
do that by different innovations and
Yeah.
research. But in general, they think within kind of our structured um, rhetoric of how we're taught in medical school to think.
So I think it's amazing that you've pioneered integrative medicine and perioperative care in a holistic way at Hopkins. So let's kind of take a deep dive into perioperative care here. First of all, what is perioperative care? What are some of the important considerations prior to surgery and things like that? Let's kind of start with some definitions for our listeners.
Sure. Yeah, the perioperative period it's a defined period that includes a before the surgery period, the during the surgery period, and the aftermath after the surgical period. And anesthesiologists nowadays, we used to be thought of as just the person that's going to be in the operating room taking care of you while you're asleep and then waking you up and getting you through the recovery room process. Now we're really taking ownership of that entire perioperative period. So we're physicians that not only specialize in caring for patients in the operating room, but we can really evaluate them before surgery and make sure whatever conditions, issues, medical comorbidities are happening before surgery, that we optimize that and that we make sure they're fully evaluated so that we can take the best and safest care of them during the surgical period. And then we also have specialists that take care of patients after surgery, whether that be in the ICU, so intensivists that specialize in ICU care and beyond. There are physicians now that specialize in pain from the anesthesia perspective. And so we take care of people after for the long term as they recover and help people wean off of opioids, for example, a very important part of recovering now that we're in a day and age that there's a lot of awareness of opioids and the potential dangers they have.
Yeah.
Yeah.
Yeah. And so, what are some important considerations prior to surgery? What kind of self-care is important, do you think, prior to surgery? I would say first.
It's a great question. I think this is an area that is now being looked at in a more structured way more than ever. Previously, we just thought more about getting people through surgery and then helping them recover. But now we're expanding that view to what can we do ahead of time to optimize people so that their outcomes are even better. And so it's a great question. And I think it's one of the right questions to be asking, especially if you have the luxury of time before surgery. There are some surgeries where it's emergent, it's immediate, and you only have maybe hours to days before surgery. Someone comes in with a new heart attack and it's determined they need heart bypass surgery. You don't have the luxury of preparing for 3 or 4 months versus if you're having something like an elective joint replacement. If you're having a knee or a hip replacement, you may have the luxury of let's get prepared and do what we need to do to optimize ourselves before we go into surgery, because we know clearly being healthier before surgery improves your outcomes. It improves your ability to um, smoothly get through the recovery process, avoid complications, get out of the hospital sooner, suffer less side effects of anesthesia, surgery, and recovery process. So some of those components are basic components that we would talk to anyone about a healthy lifestyle, right? Nutrition is always a huge foundation of what we talk about in the health and wellness world, in integrative medicine and functional medicine. You're not talking about a proper foundation of health if you're not talking about nutrition. Same thing for preparing for surgery. Some of the slight differences are we know that blood glucose control, so blood sugar control before surgery, has a major impact on surgery outcome, things like wound healing, things like risk of heart events after surgery. So paying attention to whole foods and low glycemic index type foods, super important in the days and weeks before surgery. The range and the spectrum of all of the rainbow colors of fruits and vegetables, because that's where all of those phytonutrients and really important chemicals that help give your body building blocks before surgery come from. The other thing that may be a little different before surgery is what's called a catabolic state, meaning your body is in the process of breaking down its components rather than building up its components. So when you sort of take your body and put it in that catabolic state, in order to recover and heal, your body needs to provide the building blocks for all your cells to start building up the tissue that got damaged during surgery. So we think of that, and one of those components is protein. So perhaps there is a little elevated need for protein in the weeks before surgery, so that you have enough.
Just to get a drill down on that, if you don't mind, Rosie.
Yeah.
How many grams of protein would you say people would be recommended per body weight if they're trying to build that up?
Yeah, so in general, what's recommended before surgery is about 0.8 grams per kilogram of body weight in the weeks before surgery.
Okay, like 3-4 weeks, that kind of time frame?
Yeah.
Got it. And then for the blood sugar, I'm wondering, do you ever recommend people go on continuous glucose monitors, either preoperatively or perioperatively, to just understand where the glucose level is? Have people done that there?
That's interesting. We haven't gotten to that level to see if that kind of eye toward really minutely controlling it makes a difference. But we do know that glycemic control in general is beneficial. So I can't say I've recommended anyone buy a continuous glucose monitor to monitor themselves through the perioperative period, but certainly putting into place the lifestyle behaviors that impact glycemic control, that's where I put the focus on.
Yeah, the whole foods diet, rainbow, healthy proteins,
That's right.
fats,
Avoiding simple sugars.
Right. And just for all the listeners out there, I think most people may know this, but alcohol is also a simple sugar, so we wouldn't want to really drink.
As well as putting a load on your liver, right?
Yes.
And your liver is part of what's going to metabolize all of the drugs that you're given perioperatively. So you want to give alcohol and caffeine a break. Remember, caffeine too vasoconstricts blood vessels, and you need good blood flow to all your body parts to help facilitate healing as well.
Got it.
So alcohol and coffee for the couple of weeks before.
Just totally eliminate, ideally. Got it.
That's ideal.
Mm-hmm. And I believe there's been research throughout the last few decades on smoking cessation, right? Even if people are smokers and they want to quit, even I think quitting before surgery, versus someone that, was a non-smoker throughout their whole life, I think there's still some benefit, even if they have smoked a long time, to quitting before surgery, correct?
Yeah, that's right. Now, what people don't know, and we know this from the literature, I would never discourage anyone from quitting smoking, because I think, and we know that wound healing and blood flow, that's improved by quitting smoking, even in the short term, is beneficial. However, I will mention this just for our more sophisticated listeners. It takes about 6 to 8 weeks for the lungs to sort of start clearing up some of all the carbon deposits that have been in there, and the cilia, the little hairs that line all of the airways, start to come to life when you quit smoking. They get sort of paralyzed when someone's smoking. So when they start to come to life, they start kind of moving up all of this junk that's been sort of lining the lungs.
Detox.
And people start coughing up more junk. Sorry?
Detox.
Detox, yeah.
Yeah.
So as they start coming, so we know that if people have quit within that 6 to 8 week period, slight increased chance of pulmonary complications, just because their lungs are doing what they're supposed to do and they're detoxing, they're bringing up that junk. But it's not the ideal time to be mobilizing and detoxing right before a surgery.
So
So
if they
that's the
know
one.
they're having some surgery or wanting to plan, let's say a total knee or something like that, but it could wait a couple months, maybe try to quit smoking and get that junk out at
That's
least
right.
for, those
At
6 to
least
8
for
weeks
8 weeks would be,
before.
that's right.
Got it.
That would be sort of beneficial in the global picture.
hmm
Absolutely.
What about other hormones like cortisol or thyroid or sex hormones? Is there any association between, say, like levels of cortisol, levels of thyroid hormone like TSH, things like that, as a pituitary hormone that is, measuring thyroid indirectly, and then sex hormones in terms of that about in terms of research, in terms of affecting surgical outcomes?
Great question. An interesting question. We tend to think of the hormonal regulation, especially, I don't know, I haven't seen a lot of research on like modulating sex hormones, especially around surgery.
Yeah.
We definitely have different surgical populations that have high, low, levels all the time, especially when we take care of pregnant women around surgery or people
Yeah.
on steroid replacements.
Yeah.
But we don't have a lot of outcomes data, I would say, from modulating that, because it's not a common thing you're going to modulate just to get a better outcome
Just to get a
after
better outcome.
surgery.
Yep. Okay.
TSH and thyroid can have, especially in the more extreme, really high or really low, can have more perioperative implications than slightly higher, slightly low.
Okay.
Um,
Okay.
the cortisol is interesting because that gets into the whole question of the whole stress response, right? Because
Mm-hmm.
cortisol is part of that stress response. And what we clearly know, and this is where we talk about, the preoperative interventions of like guided imagery and things to help lower that stress response and the anxiety before surgery. But what we know about the stress response in the body is that there is a natural biphasic response. So there's two parts to this inflammatory response with surgeries. There's a big surge right after the surgical insult. So when a surgeon comes at you with a knife and they do damage to your tissue,
Mm-hmm.
and then that response calms down, and then as things heal, as the tissue starts to heal. Part of that is, in the integrative world, we tend to think sort of more anti-inflammatory is better. However, in surgery, you still need that inflammatory surge to kick off the healing process. So we don't want to squelch
Yep.
it all together.
Yep.
So we want sort of the natural rise of cortisol and, all of the norepinephrines and epinephrines and cytokines and things, because that begins and that's part of the healing process. The problem comes when you have a very prolonged and exaggerated stress response. That has been shown to impair and delay healing and being implicated in a lot of postoperative complications. So when I think about kind of cortisol and the stress response, it's like, let the body have its natural response afterwards. Don't completely squelch it. And then sometime in the recovery process, that's where you do want to reinstitute all of these anti-inflammatory interventions so that reaction can come to its natural conclusion.
Great. Thank you so much, Rosie. So a lot of questions just generated from that based on your amazing answers here. One of the things is that, the surgeon's coming at the patient with a knife, or, obviously there's a lot of vulnerability there. The patient's unconscious, they're in general anesthesia often, or at least LMA. But the idea is that, that person's really leaving their body to the surgeon, right? And to the anesthesiologist. But what role does trust and the relationship between the patient and the practitioner have to do with outcomes, wound healing, decreased complications? Does that play a role, and how can that be fostered, in terms of strengthening that relationship?
So important. And the longer I've been practicing medicine, this is such a particularly vulnerable time for patients when they're coming in to have surgery. Most of us in modern life and in our modern world, we have control over our daily activities and what happens to us. And we like that. We like control.
Yes.
And so when you come in to have surgery, you really have to shed all of that control. And people are just doing things to you without your making those decisions. And it's very anxiety provoking and vulnerable. And that's, again, why it's imperative that you feel trust in the practitioners and providers taking care of you,
Hmm.
because your life literally is in other people's hands, and it's their responsibility to get you safely through that. And that generates a lot of anxiety. The stereotype of anesthesiologists is that we got into this business because we have no people skills. So
I think
that's the
knowing you,
stereotype
that
about.
could not be farther from the truth, but yeah.
I mean, it may be true in some instances, but I actually think the opposite, that we have a shorter amount of time to really get to know our patients and build that trusting relationship in a small amount of time.
Yeah.
Because even though our relationship with the patient is short, it's a very intense and, like I said, a very vulnerable time for patients. So
Yeah.
I always take time to acknowledge perhaps the anxiety and the uncertainty that patients may be feeling, especially in the preoperative area. And I make sure that they know that all emotions are welcome, because patients have a lot of emotions. And then in the preoperative area, because it's that moment right before this whole big black box that's going to be happening to them starts. And so people
Yeah.
have different feelings and different ways that uncertainty comes out. And
Hmm.
that's okay.
Yes.
We can be
And
present for all of that.
and I believe, as integrative medicine practitioners, we both believe, obviously, in the connection between mind, body, spirit, and how the body is really, even for something as vulnerable and invasive as surgery, the body's trying to heal itself post-operatively, right? But even preoperatively, I feel like what's happening is the body's probably anticipating, that person's energetic body's anticipating there's something's going to be happening, and, preparing that person, building that trust up, that relationship with the practitioners, with the system, with the hospital, etc. That can be really healing and pay dividends in the short and long term, post-op as well.
It really can. Having that lines of communication open with the surgical team, we know that even just education, which means having a conversation about what to expect, what it's likely to be like, how you can prepare best for it. Even just if we think about it on its most basic level, that improves outcomes because patients are more mentally prepared.
Yeah.
When we broaden that to the mind body connection that you mentioned, I think mentally preparing for surgery is one of the biggest things that patients can do for themselves to help smooth out and help their own outcomes.
Great. What specific recommendations do you have to mentally prepare for surgery? And I do want to touch on like music and guided imagery too. That would be helpful to talk about, because I know we've talked about that before. But what kind of mental strategies or kind of tips or tools or techniques have you found to be really helpful for patients in terms of preparing for surgery?
Yeah. I think some type of guided imagery, since we're not all pre-trained in how to do this. I think the people who sort of have that mind body connection, which is really the autonomic nervous system that controls the stress response and the relaxation response, that's what we're
Yes.
talking about.
Got it.
Like Tibetan monks and Buddhist monks who may spend a good portion of their day really turning inward and learning how to very finely control that autonomic nervous system. So for us who are not maybe as practiced in that, having a guided imagery, I think is a really good way to prepare. And there's several on the market out there now that have been developed that are preoperative sort of guided imagery preparation.
Which ones do
Audio.
you recommend for listeners if they are
Yeah,
kind
so
of
some that
thinking
I
about
really
surgery?
like, I use a lot Peggy Huddleston's Prepare for Surgery, Heal Faster.
Okay.
Martin Rossman has another one that is preparing for surgery,
Okay.
and a third one by Bella Ruth Napperstack
Mm-hmm.
also has a preparation. So those three are very good, I think, in helping people. I think doing something is way better than not doing anything to mentally
Yes. And,
prepare.
and also it does give people back a little bit of that locus of control, like they're doing something, even though they're about to go under anesthesia and be a bit at the mercy of the surgery, in general. But that's great. And what about music? I know you had mentioned before about listening to favorite music and kind of calming down the nervous system, balancing that ANS, like you said. What are your thoughts about listening to music? I guess in the perioperative period, both pre and post as well.
Yeah, there's actually a lot of data on, studies looking at when people listen to different types of music. And I want to be clear because there's now emerging two types of music. One is called music medicine, and that's kind of what we think about when we think about you passively give someone music to listen to,
Okay.
music either they like or they resonate with. There's some data to that whole the Mozart effect, where certain beats, like 60 beats a minute, which is closer to the heartbeat, may help calm that autonomic nervous system. So listening to something like that versus so that's one category, passive listening music medicine. The other category is what's called now music therapy. So this is an interactive session with a therapist where then you more actively think about music and maybe create it or listen to something that in very particular ways. So when we think about perioperative, what's been studied most because it's most implementable is that music medicine. And most studies have found a favorable outcome on using medicine to help calm anxiety, even to help pain scores and side effects after surgery.
So
And
I'm gonna.
I think people would agree, right? Most people feel good when they listen to music they enjoy or soothing music. And so I think it makes sense. And it's something that most of us can have on hand nowadays, right? Some earphones or, earbuds and a cell phone.
Yeah, so it's time for a humorous and potentially semi-controversial question, but do you recommend that the patient choose the music medicine or even the anesthesiologist versus the surgeon? I'm curious about that.
Oh,
How
in the
in the
operating
OR,
room?
yeah, in the OR, right? Like what if it what if it actually influences, right? 3-4 hour surgery, 6 hour surgery, maybe the patient should be part of that, and just not sure if that would
Well,
upend all
I
the
think
things.
I think that's an easy answer when we think about the patient because there's an easy way to isolate the patient from the rest of the operating room because I think if they're just listening to the general talk in the room plus music, I think that's less ideal perhaps for their subconscious that may be listening to kind of the garbage conversations we may be having. They don't need to hear
They don't need
sort
to
of
hear
what we're
that.
talking about in
Got
the
it.
operating room.
Yep. Yep.
But if you can isolate them and with earbuds, headphones, something like that to listen to something more ideal, continuation of the guided imagery that they had been practicing ahead of time or some type of music in the operating room, I think that would be far superior.
Is that happening at Hopkins now? I didn't realize that. Yeah.
It's not. It's not, but it is,
Okay.
I think, would be very beneficial. I used to
Yeah.
have patients just bring their own devices with their music into the operating room. And because of an unfortunate event where someone was trying to audio record on their device in the operating room, we
Oh,
now
okay.
have, policies designed,
Again, to not do
against
that.
that kind of
Got it.
violation of privacy.
Yeah.
So until we can use more MP3 players or things that are not recordable, I think
Yeah.
that would sort of be a more ideal solution.
Yeah.
But
Maybe
those have to
something
be
owned
purchased.
by the hospital that could just be kind of
I think
utilized in that
so. I think
setting.
that
Got
would
it.
be, the hospital liability would find
Yep.
that superior.
Yeah.
But I
That
think
makes
the
sense.
benefit
Yeah.
of music is undeniable.
Absolutely, yeah, and we know that we kind of think about biology in terms of we are a collection of cells and organs, and we have different everything kind of communicates together. But then on one level, on an energetic level, we're also vibrational frequencies, right? And so the music is speaking to that, and if we can have that aligned with our own cellular frequencies through the music that we play, I can say that would likely be healing for the patient
That's right.
perioperatively
Although
too.
there hasn't been randomized double-blind controlled
Yeah.
trials on that,
Yeah.
I agree. We know there's this phenomenon of entrainment where you can sort of, your energetics can align with other energetics. So why don't we bring the best, most positive energetics that we can to help our body facilitate its own natural healing process? That's what this
Yes.
is all about.
That's awesome. And then I know you're a medical acupuncturist as well, correct?
That's right.
And
Yes.
curious if
I'm trying
you've.
to follow in your footsteps, Andy, to
Well,
have
I
all the
should give a
wonderful,
shout out to my
amazing
sister
skills.
Michelle, who introduced me to medical acupuncture as well. But yeah, actually even for functional medicine, Dr. Joffrey, who's I believe now in Florida, she introduced me to functional. So it's all about kind of communicating, networking, and really understanding. From our friends and family, this is often who leads the way. So definitely you as well. I've certainly looked up to you and what you've done here in the academic setting. But I would say one other question I have about sort of the perioperative environment and setting and integrative modalities is for acupuncture. What is the role of acupuncture in perioperative care? Reducing perioperative pain, decreasing decreasing complications and increasing, I guess, the effectiveness of recovery.
I think acupuncture is one of those most exciting and forward thinking things that we can do for a perioperative patient because the data is so favorable with reducing the need for postoperative opioids, so lowering pain scores, preventing side effects like nausea and vomiting after surgery, which is the most common side effect after general anesthesia by far.
Hmm.
It's shown it can help with some of the common post-op complications like faster time to bowel and bladder function.
That's
So
huge.
ileus is a
Yeah.
huge morbidity afterwards. Urinary retention, where just people can't get that urinary stream going. Again, a huge issue. And it's also beneficial in preoperative anxiety too. One of my favorite stories is right after I was just credentialed in medical acupuncture, I had a patient reach out to me, a young woman who was traveling to Hopkins with a shunt in her brain. So to help drain some excess fluid in her brain, a VP shunt that she had. And she would get periodic revisions of this. She said no matter what drugs and whatever we did to help her after surgery, she had nausea and vomiting for 3 days straight every time she had surgery. And she said it was so miserable. Was there anything I could do to help? And I was brand new. And I said, you know what? Let's try. So I did some in the preoperative area just for about the 20 minutes before surgery, while she was, waiting for her surgery to happen. I did some acupuncture ahead of time, and no nausea and vomiting in the recovery room. She was so
Nice.
thrilled.
That's so
And
great.
and we repeated that. She's come back since, and had
Hmm.
another one. And she goes, "Oh, please, I hope you're there. Can you do it again?" And I did, and no nausea and vomiting. So it's really exciting to have just a tool that you can use in real time, simple,
Yeah.
that can add so much value for a patient.
I love doing acupuncture in the moment. Not that I do it every day, but as a primary care physician, in the moment, if I need to do it for something like IT band or back pain or even like that nausea, anxiety picture, using 4 gates or something like that, it can be really helpful. So that's great. You're using it in the hospital. It's amazing.
Yeah. And I want to advocate, so one of the biggest barriers to implementing this, because then you might ask, well, if the data is so good and it's so useful, why aren't we just adding it to our hospitals, especially in the day and age of the opioid crisis?
Yeah.
The biggest limitation is that there's no way, again, this all comes back down to reimbursement for acupuncturists, licensed acupuncturists to be reimbursed in a hospital setting. So there's no way for someone to hire an acupuncturist just to be in the preoperative area and the postoperative area of doing these amazing, treatments for patients. So that becomes a limiting barrier. And so, perhaps it's incumbent upon physicians to get the training themselves so they can add it in their practice.
Yeah. Is there a movement? Do you know if there's a movement towards that? Is anyone kind of advocating for licensed acupuncturists to go into hospital settings to be treating, or is there resistance there as well?
Yeah, so I think, there's desire out there. I haven't seen an organized push because this is, all in the bigger spectrum of reimbursement and how we're
Hmm.
reimbursed and for what we're reimbursed.
Right.
So as hospitals move toward more bundled payments, I think this is more and more challenging to advocate for individual services even.
Got
So
it.
it's a challenging environment to advocate for this type of individual service, but I
Yeah.
think in the long run, proving its cost benefit and
Right.
its in less drugs, less stay in the recovery room, will ultimately be its successful
Yeah. So
factor in
so
helping it
probably
get.
increasing clinical outcomes, reducing cost, and maybe starting with physicians and medical practitioners, but then potentially licensed acupuncturists down the line. I think would be great
Yeah.
to have them in the hospital too, if they're interested in that. And do you have any recommended supplements pre or post surgery? Because I know a lot of people ask about that. Are there any supplements we need to stop before surgery? We talk about that too.
Yeah, it's a really big area and there's a lot of questions about that because standard, if you ask sort of any standard, preoperative clinic surgeon, they're going to say you stop everything a couple of weeks before surgery, right? Now, there are some things I think we need to think about in terms of, I'll start with what shouldn't we be on at first. So some things that I think about these in kind of three categories that could interact with the anesthetic part of this that make me a little concerned. One of these is botanicals, herbs, supplements that impact coagulation, right? Blood thinning things. So, and we have a lot of those, right? Because what makes them and what makes platelets and things less sticky is good for the heart. So we have a lot of things that we take because it's got good cardiovascular benefit. But in a surgical situation, it could be that it might make you bleed more, and we worry about that.
Mhm.
So things like, vitamin E, high dose fish oils, all we call these the G ones. So there's garlic, ginger, ginkgo, green tea, those kinds of things have those good heart healthy properties, but they also tend to make you bleed. I
And
don't particularly
curcumin too, yeah.
Curcumin too, yeah. I don't particularly worry about them individually, but what I do worry about is when you start adding them up, plus maybe someone's on aspirin, or we have a lot of people on different types of blood thinning medicines,
Right.
not only kind of the classic Coumadin, warfarin, but we have a lot of direct thrombin inhibitors. And, so more and more
Yeah.
of the population is on those. So when you
Yeah.
start adding those up, then maybe we have a true increased risk
Kind
of
of
bleeding.
7 days before stop them, would you say, or how many days before?
Kind of the most conservative is 2 weeks. I think
Okay.
7 to 10 days is probably, the minimum amount you should stop these, just to make sure you have enough half-lives and
Half-lives.
enough of
Okay.
them is out of your system.
Okay.
Yeah.
So that
The
was.
next, yeah.
Oh, sorry. Go ahead.
Oh, yeah. I was going to say the next category I worry about is kind of the ones that stimulate that stress response, the sympathomimetics, because surgery itself is a stress test on your body. So we don't want to add drugs that are stimulating that sympathetic system, like
Kind of revving up
ephedra.
the system, yeah.
Yeah.
Okay.
So Panax ginseng may be something that people don't think about.
Okay.
Licorice, not the deglycyrrhizinated kind like DGL, but just traditional licorice, and ephedra, which is ma huang. So those are a few that I just keep in the back of my mind as things that I think probably don't need to be on someone's plate as an additional stress on the system.
Got it.
And then lastly, the sedative ones. I think that's an interesting category because I actually think we should be using them to our advantage. But, when you have a practitioner who's not aware of those and what they are and how they might interact with what the sedatives they're going to give them, you can get too much of an effect. So valerian and kava kava and St. John's wort and passion flower, those things have sedative, which are great. I think they're relaxing effects and they can help people with some of that anxiety, especially beforehand. But at this point, since I don't think we have enough awareness of, botanicals, what they are and what they do, we have to be very cautious about people being on
And
those.
then there is also the cytochrome P450 drug interactions too, and some of them probably do have an effect with anesthesia and cardiac drugs, I would imagine.
They do. I think there's only so many enzyme pathways in the body. And so there's going to be a lot of overlap in what uses what enzyme pathways, the cytochrome P450 system being among the most well-utilized pathways that we have. So I think there's a lot of concerns that if we truly drill down are probably more theoretical than an actual patient harm. But in being conservative, we do want to think about those and be
with
cautious.
Something major like surgery. That makes sense. That makes sense. I wanted to ask you about post-surgery. So like when do you feel like it's safe, in your opinion, for people to restart some of these supplements, whether they're more blood thinning botanicals, vitamins, or sympathomimetics or sedatives? I know it probably depends on each case and how they're doing too, but curious about that.
So things like probiotics, I think, should be started pretty quickly once you're starting to take
pretty
food.
immediately. I mean, like most people get antibiotics, right? A lot of people get antibiotics.
That's correct. Almost every surgery comes with at least a dose or 24 hours of antibiotics. So so we know there's huge alterations in the gut and the microbiome that happen because of that. Yeah.
How long do you think people should take probiotics? And again, this is probably an individualized approach, but post having any sort of antibiotics, whether it's an oral or an IV antibiotic.
Yeah, that's a hard question. And again, we don't have great randomized controlled trial to know when does the microbiome sort of repopulate and get back to normal. I think of the prebiotic as a placeholder. It's a stopgap toward quickly repopulating your gut with some beneficial bacteria while you get your nutrition back on board, which is really your baseline of keeping your microbiome healthy and diverse and happy. So I think at least a month to 6 weeks, maybe after surgery. Although that is, I'm just sort of extrapolating based on
I
other
agree
data.
with
I
that.
don't
I
know.
do think there's certain harder antibiotics like the fluoroquinolones that you may need even longer, based on some of the data that might be out there, as much as 6 months. So it's really,
Mm,
really, it's a lot that could, is one dose going to do that? Who knows? But these antibiotics are pretty strong, so it is possible. And this gives me another excuse to give a shout out to a Baltimore-based sauerkraut company called Hex Ferments. That is really great. So they're a good, sauerkraut would be something to help with as a prebiotic to help kind of that
absolutely. I love it.
microbiome.
I have it in my fridge. And
You
yeah,
you
so
have
it's
the hex
great.
ferments as well, or?
I haven't tried that one. I think, no, I
Yeah, so
haven't, but I'll look for
apparently
it
it's
next
in
time.
it's either in Towson or Baltimore.
Oh, okay.
It's HEX ferments.
I'm going to
Um,
look for that. I love sauerkraut.
yes, and they have a turmeric one too. Although I think food based, people could have like turmeric and they could eat fish and those type of things before surgery, right? It's not like it's if it's not a supplement. If they're eating like a food or spice, that should be
Absolutely.
okay. Okay.
And when I talked about garlic you can absolutely have those spices in food and in
Okay.
food form. Don't hesitate to do that before surgery.
And that would
It's a
help
high
confer
dose
a
supplement.
anti-inflammatory benefit to have those in a
Absolutely.
way, which might help too.
Yeah.
Great. Well, thank you so much, Dr. Scheinberg, Rosie, for being on the podcast. We have a few fun closing questions here, which I think you said, but I may be mistaken, that are you an early morning person or not? But either way, do you have a morning routine? And if so, would you mind sharing that with us?
Oh gosh. Well, by necessity, I'm an early morning person because my job. So we
Yes.
start the cardiac surgery, which is my subspecialty, starts 45 minutes other than sooner than regular surgery. So we're in the operating room at 6:45 every morning.
Those are long surgeries, yeah?
Yeah, they tend to be, at least 5 to 7
5 to
hour
7 hour. Okay.
surgery. Yeah.
Yeah.
And so to get a couple in throughout the day, yeah, we don't want to be here forever. So we try and get an early start to those. So I'm up at about 4:30.
Okay.
I don't have a very exciting morning routine. Since I've started doing intermittent fasting, I don't even make breakfast in the morning. But yeah, morning for me is just about basics. What I do when I first get to work is I do my heart rate variability for 5 minutes. I do my heart math,
Yes, we
heart
love
rate
heart math.
variability. So first thing I do when I get to work before I change into my scrubs for the day is I'll sit down and I'll open my app and put my little ear clip on and do 5 minutes of breathing. So at least I
Nice.
start the day by activating my parasympathetic system and lowering my stress response before the day might happen to raise my stress response.
Yeah. That's a great idea. Yeah, especially before surgery. Are you doing coffee with the intermittent fasting, or is it more just like water and things?
Yeah, so it's funny. I was actually never a coffee drinker, but I was always a breakfast person. So when I started doing intermittent fasting, which is tough, right? Because we don't have exact data on, what we should do. There's some data that maybe we should do it before surgery. The Prolon, fasting mimicking diet, maybe you should do that in the month before surgery to help your autophagy right before surgery.
Like
So
a
that's
5 day,
something
like a 5 days of the prolong, like
like a
one
5 day of the
5 day. Okay.
prolong. That's right. Like a month before surgery. There's some suggestion that that could be beneficial in helping prepare the
I guess
body.
that makes sense. You're cleaning out the system a bit, cleaning house a bit before surgery.
Exactly.
Cool.
Exactly. Just like vitamin D, like make sure your vitamin D levels are optimized before surgery. The little things like that
What
can
do you like
also
the D
be.
levels to be? Because I know that will be a question for
I
people.
know. So I don't like them to be bottom of normal. When I think about kind of the functional medicine view, a lot of talk is kind of 50 to 80 in that range. So I at least like them in the mid normal range at a very minimum.
Yeah, 40, 50, something like
That's
that.
right.
Yeah.
We know that's where optimized immune function happens.
Right. Right. I mean, there is this some evidence from basic science, at least, that vitamin D decreases interleukin 6. So, in that way, I suppose a mid level would be nice because then you're not having too much, but then you're probably not totally blocking it either. So it's theoretical at this point. We don't really know, but I guess we could say that safely that or is there research on low vitamin D? Like frankly, like vitamin D less than 20, let's say, is that associated with worse outcomes? Is there any
Yeah, there
research on
is.
that?
It's
There
associated
is.
with worse postoperative infections and in general, yeah, worse
Okay, so
outcomes.
so that
Yeah.
would be certainly be something. And then
Yes.
what book or podcast are you enjoying the most right now?
Ooh. Well, this heralds back to my, I think, a childlike nature, what I got back into. And I'm re-listening to, I tend to do audiobooks because I can then multitask. That makes me happy. When I'm doing my Saturday morning cleaning routine or laundry, I get to listen along.
Oh, nice.
I re-engage with the Harry Potter books.
Oh,
So
nice.
I'm
Yeah. Which book
re-listening
are
to
you
that.
on now? There's like seven, right? I think.
Yeah, there's seven. I actually am on book seven right
Book
now.
seven. All right. The
Yeah.
climax. That's great.
I know, the climax. I love it.
Yeah. Yeah. Well, they're books that are amazing to keep on reading them over and over, learn
Yeah,
something
there's
each
so
time.
many good things out there though, so it's hard to choose.
Yeah. Yeah, there's a book
Uh,
that I just got from the library. Oh, this is random, but
mhm.
if you ever watched that movie called A Man Called Ove, and then there's this author named Frederick Backman, who I think is from Sweden. It's really good. He wrote a book called Anxious People, so it actually is, and it's an
Uh,
interesting book. So if you're interested
yeah.
in more books like that, we'll talk about that more.
Oh, lovely. Yeah,
Yeah.
definitely.
And then what do you do every day to cultivate joy? So maybe like after you get out of the OR, and those type of things.
That is such a good question. What do I do every day to cultivate joy? Um, you know, I can say this is an acute, so this is more right now. When I come home, I love different times of the year, different things are blooming in my garden.
Nice.
So when I just get home and I get to see kind of like the mums right now, right? It's fall and
Uh-huh.
the mums are starting to bloom.
Yeah.
And I had just planted a couple of plants of them. So every day I come home and I'll just stand there and it almost becomes a family event. Like I'm standing there and my husband comes over. What are you looking at? I'm looking at the mums. And so we all stand and enjoy because it's just such a beautiful pop of color, when the summer had kind of made everything just green. So now I've got this pop of color again. And I just enjoy some of the fruits of the hard work of all the plantings I've done around my house. So just coming home and seeing that actually makes me internally smile.
Absolutely. Nature brings us joy for sure. We're part of
Yeah.
that. So thank you so much again, Rosie, Dr. Sheinberg, for coming on today. And how can listeners learn more about you and potentially work with you? I guess, are you doing like more integrative consults now? Are you doing only for like preoperatively, or kind of what's going on there?
Yeah, no, so I am open to integrative medicine consults. I do them, most of them in the context of cancer patients. So I'm working with the metastatic breast cancer clinic at Johns Hopkins.
Okay.
But I am open to having sort of, a diverse population. I've worked with people in chronic pain. I've worked
Mm-hmm.
with some patients before and after surgery, some people who've had traumatic events around anesthetic experiences, particularly
Okay.
as
So that
well.
could be really helpful. How do people get in contact with you then to work with you? Because I know they'd be
The
interested.
email address is heal at Hopkins, HEALAT,
Mm-hmm.
Hopkins, HOPKINS at JHMI.edu, Johns
Okay.
Hopkins Medical Institute.edu. Yeah,
So heal at Hopkins at jhmi.edu.
you got it.
Got it. And is that going to a main box or is that going to you or?
Both. It
Oh,
goes to a
really?
main
Okay.
box, but it's something that I regularly check
That you
myself.
check as well.
Yeah.
Okay.
The
All
other
right.
thing that I offer is, mostly for our Hopkins patients is I do offer for free Peggy Huddleston's preoperative workshop.
Okay.
So I do Peggy Huddleston's, prepare for surgery workshop, which I think can be really helpful for people. So if anybody happens to be having surgery at Hopkins, you can Google that
Okay.
mind body and my name, and it'll come up the link. But you can also email the email address to find out more
How
information.
how long is the workshop? Is it like a
It's 1 hour, and
one
I do
hour?
it remotely by phone.
Okay.
I think her program works best if you at least have a week to 10 days before surgery
Okay.
to do the preparation work.
Great. Thank you so much for sharing that. And I know we have likely our listeners, I'm sure, since Hopkins, there's a lot of different hospitals now, part of Hopkins. So, and I guess in general, it's great that, we've talked about this today because people are having surgeries even during the pandemic. There have been a lot of, need for both elective and emergent surgery. So thank you so much for the work you are doing in the integrative space here, academic space with perioperative medicine. Thank you so much, Dr. Scheinberg, for being on again.
My pleasure, Andy. Thank you for hosting this amazing podcast. So, yeah, all of your listeners have an opportunity to hear some of your amazing pearls of wisdom that you garnered from all of your training. So, yes, thank you for all the work you're doing for your patients.
Thank you so much, Rosie. All right. Well, good to see you and talk soon.
Take care.
Thank you for taking the time to listen to us today. If you enjoyed this conversation, please take a moment to leave us a review. It helps our podcast to reach more listeners. Don't forget to subscribe so you don't miss our next episodes and conversations. And thank you so much again for being with us.